So when it comes to looking at listening part B questions, you should be aware about the different types of questions that you can come across, because the strategy that you would need for different types of questions will be different. Okay. So what are the common types of questions that you get in the listening part B test? Is you have mainly, if you consider the main two major types. Okay. The two major types of questions that you can have is main idea and detail. These are the two major types. Out of these two major types, more commonly you have questions which are related to main idea. Main idea is the most common question type. Detail is comparatively less common. Now, under the main idea category, you have a few more subcategories. So what are those categories? You can have function question, you can have purpose, have agreement. These four categories, main idea, function, purpose, agreement, these four types of questions will require the same strategy. Okay, so the style of handling this four types of questions will be the same. And then you have other two types, which is detailed question. Under that, you have one subcategory. So the category that we are going to focus on today are these two categories. We are going to learn purpose questions and agreement questions today. And they are the subcategory of main idea questions. So the strategy that we will learn today is applicable to all four types of questions. Okay? But the idea is to do two things to help you get familiar with identifying the question type, so that you can understand what type of question you are handling, and at the same time give out the strategies for handling these questions. Do not feel overwhelmed by so many categories. That is why I've presented to you these categories in a way where all these four categories are more or less the same, because the way of answering those questions will be the same. And so there are two main categories, right, that you need to be aware about. But you would also need to know what is purpose question, what is agreement question, what is function question. So gradually, as you practice it, you would be able to understand those question types as well. Okay, now let us do one question here, and with that I would explain you the strategies for handling such question. Okay, so you have the question here. First of all, I'll have to decide by reading the question, what kind of question am I dealing with? So here you would have the context sentence, which will tell well where the conversation is taking place. So here it says you hear a diabetes nurse talking to a patient during a home visit. Why has the nurse come to see the patient? So it is asking you the purpose of nurse's visit. So the question prompt will help you decide what kind of question you are handling. After looking at the question, okay, you start looking at the answer choices. And when you look at the answer choices, you also start predicting what kind of information will be discussed here based on the topics or the words used in the answer choice. So the context sentence only tells you that the diabetes nurse is going to the patient's home. So you at least can predict that diabetes nurse will be mainly talking about issues related to diabetes, and patient must be having diabetes, right? Then when you look at the options here, if you look at the answer choices, it says to fit a new piece of equipment. So the word new piece of equipment, to encourage him to use new equipment, to check how he is managing with some new equipment. So all three options have the word new equipment in it. So that gives you a more clarity, right? Now you know that this conversation is not just about diabetes nurse's visit to the patient's home, but it is definitely something to do with a new equipment. Now, how you try and differentiate how these three options are different from each other, and you also try and predict if A is correct, what kind of information can I expect? So here it says to fit, to fit. So it suggests that the nurse is visiting to get the new equipment set up. And obviously, when the nurse is going to set up that equipment, it gives you an idea that the patient has agreed to use it. That is why the nurse is setting it up. Second one says to encourage him to use new equipment. Okay, so that means the nurse will be using some persuading language. The nurse may be talking about, say the benefits of that. She may be giving some recommendations if this is the correct answer. C says to check how he is managing. So the word check tells me that she may have a set of questions, okay? Or the patient, one more thing it tells me that is that the patient has already started using it. The nurse is now, visiting to check if the patient is managing well with it or not. So how, you can see that even though all of them are about a new equipment, there is a minute difference in the answer choices. So this is what you have to do in pre-listening time. You get only 15 seconds time. So your thought process has to be really fast. The Linux processor would not work. You would probably need Mac. Yeah. So it has to be really fast, the processing. So what we are going to do now is we are going to answer this question. I'm going to play the audio for this question, and you have to answer this, whether it is A, B, or C. Why is the nurse visiting this patient? To fit the equipment, to encourage him to use new equipment, or to check how he's doing?
Glucose monitor I was telling you about with me. You know, the one I said that make your glucose readings easier.
Just a moment, I would get the screen first.
I've got that new glucose monitor I was telling you about with me. You know, the one I said would make your glucose readings easier and less painful?
That'd be good. I'm sick of pricking my fingers to squeeze out a bit of blood to test.
This is a completely different system. Look, the sensor's quite small. You insert this small tip just under the skin at the back of your upper arm. It stays there for up to 2 weeks.
What about showering?
Oh, it's water resistant, so you can shower with it in place. The sensor measures and stores 8 hours of your glucose readings, so you can adjust your insulin dose as needed. I'll leave this one here. It's completely up to you whether you use it or not, but I think it makes sense to, if you can.
Righto. I don't mind giving it a go.
So I'm sure after listening to this, you would have been able to rule out C clearly, because the nurse was persuading him to try it, isn't it? So definitely C is out of place, because this is for the first time the patient, gets to know about this equipment. And the patient also expressed that I'm sick of pricking my finger. Now you have two answer choices. Is it just to fit the new equipment, or is it to encourage him? So if you look at the expressions that the nurse used, I'll just get the transcript on screen before we discuss the answers. Here. You can see here the transcript. So the nurse was explaining that this is a completely different system. She explained how it works. Then she also pointed out that it is water resistant. Then she also said that it is completely up to you whether you use it or not. That means the patient has not yet decided. And the patient also said that I don't mind giving it a go. So the patient is just trying it out. Giving it a go is to try out. And the nurse was recommending it, that I think it makes sense to use if you can. So it was not just fitting the equipment, but also encouraging him to use it by saying that it is a very simple system. It is very small. Okay, it is different than the current system that they have been using. It is water resistant, and it is, although it is up to them to decide, the nurse thinks that they should use it. So that gives me an idea that it was not simply to fit the equipment, but to encourage him to use it. B is the correct answer here. Because of the type of language that the nurse chose here. If she was here only to fit it, she might have not highlighted the benefits, and she might not have also given out her opinion that it is completely up to you, but I think you should use it, isn't it? The recommendation that you can see. So fitting usually happens once the patient has decided, has agreed to use it. Here, the patient was going to try it for the first time. So that is another reason why fit is not the correct answer. So this is what, when you are dealing with main idea questions, what you need to be careful about is you are looking for the summary of that 55 or 60 seconds conversation. The answer choice here also will be inferential. It is something that you have to infer from what you are hearing. So you may not hear the exact words in the audio, but from whatever they are discussing, you need to get the summary of why is the nurse saying all those things to him. So the reason why she was saying those things was to encourage him to use it. So this is how purpose question will be. We are going to do one more purpose question to help you understand and to help you practice the strategies to deal with it. So we have one more purpose question here on screen. You can again see the typical question prompt. A pharmacist, this is the context sentence, is talking to a patient about medication. Why? Okay, so this is purpose. Why does she give a verbal explanation of the side effects? So see here, after reading the question, you get to know that this conversation is going to be about medication and its side effects. And the nurse is, the pharmacist is explaining these things to the patient. Now you have to find out, why is she giving verbal explanation? Is she trying to highlight severity? Okay. So is she trying to say that, you know, all these side effects are written already on the booklet or on the leaflet, but I just wanted to warn you that you have to be extra alert about these side effects, because they could be life threatening, or they could be quite a serious complications. So highlight their severity. If this is the answer, then you can hear something similar to this. She may use, it can become fatal, it can be life threatening, it could lead to quite serious complications. I wanted to warn you, I wanted to alert you. Okay. If B is the correct answer, ensure that patient understands. So if this is the correct answer, okay, then the pharmacist might be using this term that, it is all written there in the leaflet, but I just wanted to simplify things for you and to make sure that you are able to understand the side effects. And third one says, to allow the patient to raise any concerns. So if this is correct, the pharmacist is explaining the patient about it and giving patient a chance to ask any questions if they have. So keeping these three things in mind, now we would listen to this conversation. You have to find out, why is she giving verbal, or why the pharmacist is giving verbal explanation. Is she trying to warn the patient about severity of the side effects? Is she trying to simplify things for the patient so the patient understands, or is she trying to explain the patient and allow the patient to ask doubts or questions? Again, remind yourself that you have to go for an overview of the entire conversation. You would definitely hear something about the side effects here, the severity of it. Okay, but what the correct answer choice will be the good summary of this entire conversation. So here we go. I'm going to play this now.
I'd like to go over some possible side effects of your atorvastatin medication. This is all explained in the booklet I'll give you, but I want to make sure I answer any queries you may have before you're discharged. But remember, you should contact your doctor or the ward immediately if you have any concerns.
Okay, thank you.
The less serious side effects are commonly mild muscle pain or nausea, occasionally diarrhea. The more serious include severe muscle pain, confusion or memory loss, fever, fatigue, a change in weight, dark-coloured urine, or sometimes an increase or decrease in urination, increased or loss of appetite or thirst, jaundice, and possible clay-coloured stools.
That's a lot to take in.
You won't need to remember them all, but it's important to be aware of any changes. Is there anything you'd like to ask?
No, I think I'm okay.
Okay, so type in what answer do you think is correct here. Type in privately so other students don't get distracted by your responses. So it's great to see that nobody has gone with A. So that's great because, yeah, she did talk about side effects, but that was not the main purpose of the entire conversation. Yeah, so it is C is the correct answer here. To allow the patient to raise any concerns, I would just show this to you in the transcript as well. So she did ask if the patient was able to understand or not. Okay, but she said clearly that it is all explained in the booklet, but I want to make sure I answer any queries you may have before you are discharged. But remember, you should contact your doctor or the ward immediately if you have any concerns. So they were trying to give the patient an opportunity to ask questions. Then she explained all the side effects, but again, she simply described those side effects. She was not trying to highlight its severity, right? Because she was just listing down the side effects. She didn't use expressions like, I must warn you about this, or it's important that you are alert about these side effects particularly. In fact, when the patient said that's a lot to take in, the pharmacist made it clear that you don't need to remember all of them, but you just have to be important. You just have to know that it is important to be aware of any changes. Is there anything that you would like to ask? So basically, the purpose was to explain verbally. Otherwise, they have mentioned already that it is all has been given to them in the booklet, yeah, in the form of a booklet. But why the pharmacist is giving verbal explanation so that the patient can ask if they have any concerns. So that is the reason why C is the correct answer here, to allow patient to raise any concerns that they may have. Because as we predicted, if B was the correct answer, they might have said that the language in the booklet is very difficult, so I just wanted to simplify things for you. But we didn't have any such expressions. We didn't also have any expressions about highlighting or warning about the severity of the side effects. Okay, so this is how the purpose questions will be, where you will have to understand the purpose of what one person is doing. You'll hear it could be a monologue or it could be a dialogue. Okay? And you will have to understand the ultimate purpose of why that conversation is happening there, or why the nurse is warning them, or why the nurse is having a dialogue with them. So you are looking for a good summary of that. So let me give you a typical example. If say for example, if I was the nurse manager, okay, and if I wanted to tell the nursing staff of that unit that they have not been following the protocol of giving back care to each patient every 4 hours. So if I wanted to remind them, if that is my purpose, I would not straight away go and tell them that you all are not doing this, so you should do it. Instead of that, what I would do is I would provide some background information. I would say that, over the past 6 months, statistics suggest that the number of patients who develop back sores or the bed sores in our unit has increased by 5%. As a result, a lot of patients have to stay in the hospital for a very long period, and this is leading to additional cost and the stress that the patient have to go through. This also affects their overall recovery. Therefore, it is very, very important that all of you stick to the protocol of providing back care every 4 hours. So I gave statistics there, right? But that was not my purpose. why I gave statistics was, using that statistics, I was trying to emphasize the need to provide back care. Right? So in purpose question, you should not get taken away by small details that are given in the audio. You have to focus on why they are saying those things or why they are doing those things. What is their purpose? So other two answer choices may be factually correct. I did give statistics. I did talk about, the proportion of patients that suffer. I was also trying to highlight the emotional stress or the financial burden, but that was not my ultimate purpose. Using that emotional stress, financial burden, and statistics, I was trying to remind my staff that they should follow the back care procedure or the protocol, which is very much there in place. So that is how the purpose questions are to be taken care of. Okay, we have one more question, that is purpose questions. I'm going to get that on screen now. So those of you who were not able to get the previous two questions correct, this time make sure that you are able to get it correct. Okay, so I have got it on screen. It says a nurse making a telephone call to a doctor. Why is he calling the doctor? He needs advice about patient's medication. One of her patients has had a fall overnight. A patient is asking to see the doctor or to see her urgently. So why is the nurse calling the doctor? Remember, you will hear something about fall, something about medication, and something about the patient's wish to see the doctor. You have to find out what has triggered or what has prompted the nurse to call the doctor. Yeah, and this particular conversation I'm going to play it twice to give all of you an opportunity to review what you have chosen, and I want to ensure this time that we need 100% correct answer. Each one of you should be able to get the correct answer.
Good morning, Dr. Coles. Thanks for getting back to me. I'm Gareth, and I'm a nurse on ward C3. I'm taking care of your patient, Mr. Glover. He's a 70-year-old man who's here after a fall at home where he broke his hip. Are you familiar with him? Great. Yeah. The reason I wanted to talk to you is that there's been a bit of variation in his vital signs. His temperature's 37 and his respiratory rate's 16, but his blood pressure, that's 80/56, which is quite a bit lower than it has been. I held his BP medication this morning, but I was wondering if we could have parameters for when to hold it and when it's okay to give it. Also, he's complaining of feeling weak and tired, and he's asking when you're next likely to be doing your rounds, so I think he's aware of a change too.
Now for the second time.
Good morning, Dr. Coles. Thanks for getting back to me. I'm Gareth, and I'm a nurse on ward C3. I'm taking care of your patient, Mr. Glover. He's a 70-year-old man who's here after a fall at home where he broke his hip. Are you familiar with him? Great. Yeah. The reason I wanted to talk to you is that there's been a bit of variation in his vital signs. His temperature's 37 and his respiratory rate's 16, but his blood pressure, that's 80/56, which is quite a bit lower than it has been. I held his BP medication this morning, but I was wondering if we could have parameters for when to hold it and when it's okay to give it. Also, he's complaining of feeling weak and tired, and he's asking when you're next likely to be doing your rounds, so I think he's aware of a change too.
So type in your responses for me. Some of you have already sent, I can see that. Is there a problem in audio? Did any one of you have the problem with the audio? Was it not audible? It's a phone call, so yeah, you can expect that, there will be some difference. Yeah, so it's basically not any technical fault. This is how the audio can be sometimes. You can have people with different accents. So this shows that you are uncomfortable with certain types of accents. So here the accent is slightly different. There's nothing wrong with the audio. So you'll have to get familiar with this different types of accents and different types of styles of speaking. And the voice modulation would also be there. Like everyone has a different way of speaking. So you can't choose who is going to be your patient. Whatever, their style is, you will have to understand them. You have no choice there. Okay. So here, again, they did talk about the fall. They did talk about, something that the doctor was, when the doctor was going to come for the rounds, but it is not urgently. They never used any word related to urgently. The main conversation, in fact, focused on how the patient's blood pressure is fluctuating. And because of that, the nurse has already withheld one dose, and he wanted to check when to hold and when to give it. Yeah. So you can see here, the reason I wanted to talk to you is that there has been a bit of variation in his vital signs. And his blood pressure is a bit lower than it has been. I had his BP medication this morning, but I was wondering if we could have parameters for when to hold it. So he was seeking advice. He was seeking advice for finding out when to give this medication. So is the internet causing problem? My voice is also getting affected. Is the internet causing problem? Am I not clearly audible? I'm sorry about the inconvenience.
No, ma'am, you are not.
Not audible? I see. So what that's let me just change the internet connection if that works. Okay, is it any better now? Okay, yeah. So the reason he was calling was because there has been a variation. He was explaining there has been a variation in his blood pressure, and I have already had BP medication. But I was wondering, this is standard expression when you have a doubt about something. So instead of saying I have a doubt, native speakers would say, I was wondering if we could have parameters for when to hold it and when it is okay to give it. So he was seeking advice from the doctor, if the doctor can guide him when to give it and when not to give it. Also, so that was another reason. He's complaining of feeling weak and tired, and he's asking when you are next likely to be doing your rounds. So it was not urgently. The nurse was just trying to find out when the doctor is going to visit. Even patient has not said that, the patient has not demanded that they want to see the doctor urgently. That is why this technique of underlining negative, blanket and extreme words works wonder if you are able to do that. Okay? Urgently is the extreme word. So the patient is not demanding that they want to see the doctor immediately. They were just asking when the doctor is going to visit next. And again, that was not the reason why the nurse was calling. Because he was calling, he also talked about the another issue. But the main issue, he said, is checking and getting advice about patient's medication. He needs advice about patient's medication. I was wondering if we could have a parameter as to when to give it and when to hold it. So he was seeking advice. Right? So that is the main challenge that you have when it comes to this 4 categories of question. Once you learn the strategy, it is not that difficult, but you will have to overcome this style of selecting your answer just based on one word or one sentence. If you do that, it won't work. You are looking for the overview of the entire conversation and not one word or one sentence. That typically in these 4 types of questions. Okay, so now we have 3 more questions, and this time the questions are based on agreement. Okay, now we are going to look at the agreement question. I'll get it on screen for you. So can you see here? It is very, very easy to identify agreement questions. Straight away you can see this. They agree that. So you have to find out on which point both the nurses agree. 2 nurses talking about a patient on their ward. So you can predict what kind of conversation they may have if they are talking about one single patient. Okay. And then when you look at the answer choices, you get more clarity on what kind of conversation this will be. So first one says entitled to complain. What do you mean by entitled? To have the right. Yeah. Or his complaints are, for example, what they are trying to say is that they are justifiable. This is a positive option. A threat to staff safety. Threat means when they are, violent or aggressive, and if they have actually harmed any of the staff members. And C says behaving unreasonably. So see, A and C are exactly opposite to each other, because A says entitled to complain. That means both of the nurses feel that the patient's complaints are genuine. He's right in complaining. But C says he's behaving unreasonably. That means both the nurses feel that the patient's behavior is unacceptable. Is unacceptable. So this is a prediction that you would have to do. Now it says they agree that. So what would happen here is, one nurse would say something and the other nurse would say, no, it is not true. Again, in the second point, the other nurse would say this is the case, and the first one would say, no, it is not the case. So there will be one point where they both would agree. You have to find out which is that point. Do they both think that the patient is violent or aggressive? Do they both think that the patient is, patient's complaints are unacceptable, or do they both think that his complaints are genuine? So agreement questions are otherwise easy to deal with once you learn the strategy of dealing with them. Okay? So now I'm playing this audio. You have to check where on which point both the nurses agree. This is also I'm going to play it twice. So make sure you are able to get correct answer here.
Mr. Lee just threw a spoon at me.
A spoon? Why?
He hasn't stopped moaning about me all shift, so I told him to stop. That's when he threw the spoon.
Did it hit you?
No, he's harmless, but that's not the point. He just won't let up. He's fine with other staff, but everything I do seems to be wrong. Apparently, I wrapped his bandage too tight, and he even moaned that I didn't close the curtains properly.
Honestly, it does sound like he's singling you out a little. That's hardly fair.
No, it's not, is it?
I know. Let's ask if you can swap patients with me.
Really? I'd be glad to if you don't mind. I'm sure it's just me he's taken against. I don't want to go back into his room ever again.
I'll give him a few minutes, then I'll go in and try to talk to him.
Mr. Lee just threw a spoon at me.
A spoon? Why?
He hasn't stopped moaning about me all shift, so I told him to stop. That's when he threw the spoon.
Did it hit you?
No, he's harmless, but that's not the point. He just won't let up. He's fine with other staff, but everything I do seems to be wrong. Apparently, I wrapped his bandage too tight, and he even moaned that I didn't close the curtains properly.
Honestly, it does sound like he's singling you out a little. That's hardly fair.
No, it's not, is it?
I know. Let's ask if you can swap patients with me.
Really? I'd be glad to if you don't mind. I'm sure it's just me he's taken against. I don't want to go back into his room ever again.
I'll give him a few minutes, then I'll go in and try to talk to him.
Type in your responses for me. No, how come B? Because they said he's harmless. Didn't they? They straight away said he is harmless. So he's not violent, he's not aggressive. He is aggressive probably, but he's not, violent. He's not actually threatening the staff, or he hasn't actually hit the staff. He just threw it, but it didn't hurt. So again, see, yes, we had to have the whole, we had to look at the overview of the entire conversation. So they said that he threw a spoon. Did it hit you? So the nurse said, no, he's harmless. So this helps me to rule out B. But he is behaving unreasonably, because here they said that whatever I do seems to be wrong. Everything I do seems to be wrong. And then she was giving a few examples, and the male nurse accepted it. Honestly, it does sound like he's singling you out a little. That's hardly fair. Yeah, so that's not fair. If they say it would be very easy for you to catch, but they would use those kind of words, hardly, rarely, instead of saying no straight away. So correct answer here is C, behaving unreasonably, because they said it is not fair, right? The nurse who had the experience was apparently not happy with his behavior, and the male nurse also accepted that this, not the
mirror.
Mm-hmm. Yes.
Ma'am, your voice not audible. Still breaking down between.
It's
No.
probably. Yeah, so what I was trying to explain is that both the nurses agreed that the patient's behavior was inappropriate. The nurse who had the bad experience was definitely very disappointed with his behavior. And the male nurse also agreed with her when he said, "It is hardly fair. I can swap the patient with you." So, all those things suggested to us that they both agreed that the patient was behaving unreasonably. Okay, now the next question, which is again on agreement. You hear two nurses discussing a recent change in the hospital policy. Now, see here, you don't have to find out where they both agree, but you have to find out what does the male nurse feel about it. So this indicates that you are going to have one male nurse and the other female nurse. You have to mainly pay attention to what the male nurse has to say about it. Again, you pay attention to the negatives in the question. Unsure, so he doesn't know how it is going to affect him. Unhappy, that is also negative. So the male member is not happy with the level of consultation. Unwilling, to see it as a negative development. So see here you have two negatives. Unwilling to see it negative, that means he sees it as a positive development. So C is positive, A is neutral, unsure how it is going to affect him. So he is not sure whether it will have any positive impact or negative impact. Whereas B says that he's not happy about it. Okay, let us listen to this now and do it.